Hello, this is Linda Grace Cox with MSRelief.com, and I am interviewing Dr. Christensen, who is a chiropractor. So, Dr. Christensen, take it away.
Hi, I'm Dr. Garrett Christensen. I've been working here in Alaska for about a year now and graduated from Northwestern Health Science University. And I've known Linda for a while. My family's been good friends with Linda, and Linda's been, as you know, suffering with MS for years now, but she is making some wonderful strides in helping relieve her symptoms and overcoming the adversity. The other day, Linda had used some vibration therapy, a massager on her back. It felt really good while she was doing it, and then afterwards she was experiencing some serious pains, some electrical shocks, if you will, throughout her body in various areas, and she wanted me to explain why that might be for anyone else out there with MS or knows someone who's suffering from MS. The thing is with the nerves, as you all may know, how the myelin sheath has been deteriorated. They become very sensitive to any type of stimulation, especially immune response stimulation, which we know is what started the whole thing. But when a vibration goes through the body, if it goes for a prolonged period of time, if you put a massager on your hand and you hold it there in the same spot for, say, 5 minutes, your hand's going to be pretty irritated. And you may experience some burning sensation, you may experience itching, and that's just damage to the nerves. That's micro damage. It's nothing that's going to last for a long period of time, but if you did that every day for years, you're going to you could possibly damage the nerves. So when someone already has nerves that have been damaged, any type of stimulation there can cause further damage rather quickly, a lot more quickly than someone who wouldn't have MS. Same symptoms or conditions may happen with someone who just recently injured themselves and they go sit in a hot tub or they put a heat pack on the area because it feels good. Same thing with a massager. Oh, it feels good, but then later that night or the next day you may wake up in pain, and that's because you produce an inflammatory response which produces pain. And so that's pretty much a simple explanation for you. If you want to get into any more detailed information, we can look into the physiology of it, but basically that's what's going on there. So not to say you shouldn't do any type of vibration therapy, or there's been some things that have shown to really relieve a lot of problems or pain, but just all things in moderation. A little bit at a time, see how you do, and if it bugs you, then obviously refrain from doing it.
When you say a little bit at a time, how long do you think?
You know, everybody's different. Everybody's going to respond differently, and especially with MS, certain flare-ups will come on different times. It's kind of a hit and miss thing. It's hard to say for sure. If I was the one who had MS and I was going to try it out, I would probably do just a minute or two in one area. I wouldn't just leave it on there for a long time, but I wouldn't leave it. I wouldn't say my arm was hurting me. I wouldn't hold it here and just go, ah, nice, that feels good, for a minute. I think that would be too much. I would rub it around there for a few seconds and then move to another area and rub around, because I don't want to overstimulate that one area, because it could be overstimulated rather quickly.
Thank you very much. That's exactly what I wanted to know. I appreciate your time, and I will be back again.
All right.
Bye-bye.